money that, our, as a country, we would save by implementing preventative medicine would be so incredible. Like, I mean, I don't know the exact numbers of that, but I mean, just implementing more lifestyle prevention and just going that route. Unfortunately, insurance companies aren't going to get paid for prescribing kale juice, right? So it's like,
Yeah.
it's a struggle. It's a back and forth. It's a business. And, but it's really just getting to that root cause of the issue, and not just waiting for it to happen, hoping your insurance covers that double bypass surgery. It's just, it's crazy.
Yeah. And I think that, it'll take a while for the insurance companies to, come around.
Mm-hmm.
And I think that as consciousness continues to be raised and people are aware, like, okay, that, for example, you're talking about how it's so expensive. Diabetes is like,
Mm-hmm.
it doesn't kill the most people, but it's the most expensive disease that there is.
Yeah.
So in terms of healthcare dollars, we spend 1 out of every 3 Medicare dollars treating the symptoms of type 2 diabetes.
Mm.
So it's something like estimated to cost $85,000 for the rest of your life if you've been diagnosed with type 2 diabetes. So
Yeah. And I mean, and you and I both know type 2 is, I mean, that's lifestyle, and that's something that can 100% can be prevented and reversed if you already have it.
Yeah. So absolutely. So, I mean, and millions of people have it. I think they're estimating that by 2020, we're going to spend $336 billion a year on what essentially we agree is a benign foodborne illness that
Mm-hmm.
if we could prevent it, and it's not just once you have it, you're stuck with it. Like, it's reversible too through
Right.
diet and lifestyle, which a
And you
lot of
know
people.
what? That number you just gave was probably an average of an adult. I mean, think about how many kids we see now with type 2 diabetes. I'm sure that's, that probably doubles, triples that cost if you really think about it.
Yeah. Yeah. I mean, and, it used to be called type 2 diabetes used to be called adult onset
Mm-hmm.
diabetes because there was juvenile diabetes, which was type 1, which was it's different disease. It doesn't really seem to be caused necessarily by diet and lifestyle. It seems to be more genetic, and it's linked to a few other lifestyle factors. But they called that because you got that when you're like 12, 13, 14 years
Mm-hmm.
old, and then you had it for life. Adult onset happened later in life. It was more diet and lifestyle related, but now, excuse me, like, young kids are getting it just because how horrendous their diet and lifestyle is.
Right. And another point I think we should make is, we're both chiropractors. So, if somebody's coming in with a chronic issue and their insurance company says, okay, Sally, you have 12 visits. I hope you can get healthy in that 12 visit period, right? It's like
Yeah.
they have no idea what's going on with her. So how could you possibly give a number based on a policy? It's just like, it's really crazy because unfortunately a lot of people will strictly go by that when they can really achieve health and prevent things way down the line if they would just, not have to rely on that. So I don't know if you want to go into that at all as well.
Yeah, sure. I mean, these insurance companies, are just essentially banks. They
Mm-hmm.
just operate in a ways that they sell a policy or a premium, and
Mm-hmm.
then they occasionally pay out for things, but they try not to pay out for things. So they're incentivized not to pay for care. Um, and so something with, chiropractic, and, they only give 12 visits a year. That's a pretty arbitrary number. But with somebody with type 2 diabetes, they'll pay for them to go on metformin. They'll pay if it gets
Right.
really bad to put them on insulin or to surgically chop off their toes or things like that. But like,
Right. Or that cholesterol medication. Like, it's
yeah,
crazy.
but to, like, groceries for a week on a plant-based diet, which, might cost you, you can do it as cheap as like $25 a person. And for me, it's like 60, $70 a week, it's a few $100 a month, and that's your food.
Right.
And
And that heals
that,
you.
that,
Like
that
two
works.
in one.
Yeah, and the drugs cost hundreds of, much more money. It's like
Mm-hmm.
to manage a person on type 2 diabetes is like $800 a month. And okay, oh, my insurance pays for it. So deal to me.
Right.
Um, but essentially somebody's paying that cost, right?
Mm-hmm.
So we're paying for the premiums and the deductibles and all that kind of thing. So it's much cheaper to not only manage somebody's diabetes but reverse their diabetes through diet rather than putting them on medication. But insurance doesn't pay for that.